My name is Dr. Shelley Halligan. I am a board-certified psychiatric mental health nurse practitioner, and I am the President of Medical Affairs and Clinical Operations for Speranza Therapeutics. I've been in the field of addiction medicine for over 20 years. Not only am I a provider, but I'm also a person in long-term recovery. So I feel like that gives me a great benefit into understanding the position of the patient and the family, as well as the provider. I have been at Speranza Therapeutics now for 7 months. I am the President of Medical Affairs and Operations, and what that actually means is that I'm over all of our medical and research and growth in that area. And I have the benefit of working with external providers as well as large insurance companies and large EAPs to introduce our product, the ST Genesis device, which is a percutaneous nerve stimulator that treats the symptoms of withdrawal from opiates. So from my experience as a provider for the past 20 years, it's been interesting to watch the evolution of addiction medicine and the illicit drugs that are available in the United States particularly, and how easily these drugs are to obtain. When I talk about the lethality as opposed to alcohol use disorder, alcohol usually takes 20, 30 years to ultimately take someone's life unless they're involved in an accident, where opiates, it can be one time and the person is dead. This has been the reason that our life expectancy has decreased because of the use of fentanyl and the misuse of fentanyl. And that is so disturbing to me as a mother, as a provider, and a person in recovery, that we are losing so many lives to substance use disorder that is absolutely treatable, and there's so many opportunities, and that's why I love the ST Genesis so much. As a provider, it gives you opportunities to be able to use this device to be able to transfer somebody onto an MAT, a possible life-saving medication. In the United States, the opioid crisis has reached an epidemic proportion over the last 20 years. Provisional data from the CDC's National Center for Health Statistics indicate that there were close to 110,000 drug overdose deaths in the United States during 2021. So the technology around the ST Genesis is a paradigm shift, what we're seeing in the addiction space. What this device allows you to do is get your patients on an MAT sooner without the fear of detox, which is real. It's a real fear that majority of our patients feel. And what we're hearing from individuals, large AMA rates against medical advice leaving detox because of their symptoms are not being addressed, the withdrawal symptoms. And then the fear of actually going to detox is real. They're fearful of what they're going to experience. This ST Genesis addresses all of those symptoms. And what that does, when you address all the symptoms, now the patient is engaged. Now they can have a say-so as to, yes, I want to go on methadone, or I want to go on Suboxone or Sublocade. They're a part of their treatment instead of just being directed to their treatment. And what we know is that when someone has play a part in their recovery, they have a better outcome. So our focus is to have better long-term outcomes for our patients, and it is a complete shift. So it takes a little bit of a lift on the provider's end to make that shift, but this is the future, and we have to be able to do that, just like with all other things that we see in our life, which are changing. So with this new shift, it gives providers an opportunity to talk to their patients about using this percutaneous nerve stimulator to be able to get them on an MAT, or at the end of treatment to get them off the MAT. Both are difficult. Today we are here to show you how the ST Genesis works. The ST Genesis is an FDA-cleared neuromodulation device supporting the reduction of opioid withdrawal symptoms. Inside the ST Genesis box, you will find the device itself, the cover of the ST Genesis device, a sterile pack of needles, adhesive for the device, instructions for use, which will include the expiration date. Remove the protective cover and take the ST Genesis out of the packet. Remove all the supplies and place on a clean surface. At this point, you would normally activate the battery. However, this may depend upon the COWS score, which is the clinical opiate withdrawal score, or the clinician's direction. It is essential to thoroughly clean and disinfect the area of the skin in order to avoid the risk of infection. First, clean the surface of the left ear and then the skin behind it. The cleaned area of the skin has to be absolutely dry prior to application. You're going to want to locate the areas of stimulation using the point locator. Once the auricular stimulation point is located, you'll want to mark these areas with a surgical marker on the surface of the skin. Be sure and not touch the marked points with your hand. Repeat the procedure for the other 2 stimulation points and for the ground wire lead. Pick up one of the snap fit rings in the device with the help of a tweezer and fix it into the stimulation needle placed inside the blister pack. Take care to keep the snap fit ring as straight as possible when pressing it in the stimulation needle. Similarly, repeat the same procedure to connect the snap fit rings to the other 3 needles. The single wire is the grounding wire. You'll want to keep that wire separate. This is the wire that attaches to the earlobe. The ST Genesis device targets the areas of the brain responsible for pain and anxiety through neurostimulation treatment, offering the patient a high degree of comfort and mobility. Stimulation is performed by sending electrical impulses emitted through the needles, strategically positioned on the branches of the cranial nerves 5, 7, 9, and 10. Once the device is applied, the therapy begins immediately, and it will continue for 120 hours or for 5 days. Each patient's treatment is monitored by frequent measurements of the COWS score. The frequency will depend upon the patient presentation and the clinician's practice preference. The ST Genesis allows you to continue your everyday life while recovering. This uninterrupted freedom is something very unique to the ST Genesis. If you would like to learn more about the ST Genesis, please visit our website at SperanzaTherapeutics.com. Don't press pause on life.